If you've poured tens of thousands of dollars, months, if not years of your life and your whole heart into IVF, but you're still not pregnant, this episode is for you. Hi, I'm Dr. Jane Lebec, and this is the Natural Fertility with Dr. Jane podcast, where we help couples uncover the real reason behind their fertility struggles. And today, we're going to talk about failed IVF cycles, what it actually means, and what a smart, not desperate next step could look like. You might be thinking that if the strongest tool in medicine didn't work, nothing will. Or you might be thinking, there is no way I can keep spending money like this and not getting anywhere. Or you might just be frustrated with the fact that you have no idea what has gone wrong. So the first thing that I want to tell you is that a failed IVF cycle is not proof that your body can't get or stay pregnant. IVF is a tool. It bypasses certain steps. It doesn't fix why you needed it in the first place. If those root issues were never identified or addressed, IVF is basically just gambling with your money and your health. So instead of going down the negative rabbit hole of, oh my God, IVF failed, I'm broken, the real question that I want you to ask yourself is, what is the reason that you needed IVF in the first place? Why could you not get pregnant naturally? And is IVF the right tool for you to help you grow your family? So let's dig into these questions a little bit more. And here, these are the questions that I would be asking myself if I were you and I was going through IVF as a naturopathic doctor and, a natural fertility expert. Before you sign up for another round, here's what I want to know, because I want to feel confident going into the next IVF cycle. Why did I need it in the first place? I want to have the answer to that question. It doesn't mean that I don't need IVF again. I just want to understand, what is it that's actually preventing me from conceiving naturally? Is it a blocked tube? Is it severe male factor? Is it like a diminished ovarian reserve picture, or maybe more of like a hypothalamic amenorrhea where the brain and the ovaries are not quite connecting, or the ovaries are not quite responding to the stimulus from the brain? Or were you just told that everything looks normal, everything is fine, we just don't know why you can't get pregnant, so let's just try IVF? Those two situations are very different. The second question that I would want to know is, was my body genuinely ready for the stimulation and the pregnancy? Like, was my body ready to go through everything that IVF is? And let's face it, most people have no idea what they're getting into until they're multiple cycles in and they feel terrible. So things that I would want to know are, was my thyroid in range for fertility? We know thyroid is really important for pregnancy, so doesn't it make sense to optimize it before I get pregnant? Because the baby is going to use my thyroid hormone for the first 24 weeks of gestation. I'd want to make sure my thyroid is good. What about my inflammation markers? If pregnancy is an inflammatory process and I'm already inflamed, does it make sense to put myself through another process like IVF that's going to cause more inflammation and then go directly into pregnancy that causes more inflammation? Does it make sense? What about my nutrient levels? So if pregnancy is very nutrient demanding and energy demanding, what about things like my iron and my vitamin D, my B12? Are those things optimized before I'm going into IVF to help my body, get the best possible results, but also to recover with all of those drugs and the detox that needs to happen? How about my blood sugar and my insulin? And what about my partner and his cholesterol and blood sugar and his nutrient levels? And what about his DNA fragmentation? Is it optimal? Is it below 15%? Or are they telling you that they can just bypass male fertility factor by washing the sperm or attaching a little propeller to the sperm to just move it through? Are there other things that are going on that we need to check? The last question that I want to ask myself is, why did the previous IVF cycles not work? Were they truly personalized and tracked, or were they just copy and paste? I see this all the time in practice, and the meds are usually not adjusted. They're adjusted based on maybe AMH and age, but not on the whole picture. And something that I've been telling my clients who do need, we need the assistance of IVF to help them grow their families, is someone who's metabolically healthy, someone who has really optimal nutrient levels is going to need a very different drug cocktail than someone who isn't. And the way that you're going to respond to meds is going to be very different. So were your meds adjusted based on how your follicles levels and hormones responded? Did anyone debrief the numbers with you? Did you understand everything that was happening? Do you have this documented, the number of eggs, the mature, the fertilized, the blasts? Do you have all of that information, and do you understand what's happening there? And did anyone actually look and make sure that the hormone levels were optimized, that progesterone didn't peak too soon, your immune system function was good, your progesterone was good in the second half of the cycle, and it was truly good in the second half of the cycle, versus they just gave you a dose of progesterone and assumed that that was good enough. I can't tell you how many women are like, yeah, I'm on progesterone. I'm like, okay, well, what's your level of progesterone? I don't know. They're not testing it. Why not? They didn't test it. They just gave you the progesterone. It's very backwards. I've actually had a couple who was like, I can't believe that we're coming to a naturopathic doctor for data. And I'm like, how backwards is that? Like, we had a good laugh on the call, but it's like, how backwards is that? That I, as a naturopathic doctor, and all my clinicians behind me are like, hey, we need testing so we could see what we should give this patient. And then, we have the conventional side going, no, we just give it anyways. We don't need to test. That's bananas. So those are things that I would personally want to know if I was going to go and do it again and spend all the time, energy, and money. We often talk about the actual cost of IVF, the financial cost, but what about the emotional toll? What about the energy and the strain that it puts on the couple? I think the emotional and the physical toll on the body is way worse than the financial toll, but the financial toll obviously also adds up. So now let's talk through, what do you actually want to do after you had an IVF cycle? And my hope is that you don't numb yourself and you push yourself through more and more rounds of IVF, because if a clinic is telling you that it's just a numbers game and the more you do, the higher your chances are, this is where I think women really dissociate from their bodies and they numb themselves so they could keep going. And the men are just kind of on the side watching and feeling helpless and not, just providing a deposit, and that's their part. There's nothing else they can do about it. It's kind of the opposite energy of creation and pregnancy. And the woman, I try to always bring her into her body so she feels empowered going through her cycle, even if it is IVF, as opposed to numbing yourself. But here's what I would do after a failed IVF, before, whether that's 1 round or 4 rounds or 5 rounds. My hope is that we save you the amount of rounds you do. My 40-year-old with complicated autoimmune things, she did 1 retrieval. We had 3 transfers, but 1 retrieval. And it was beautiful in terms of the amount of eggs that she got. Everybody was astonished at the clinic, at the fertility clinic. And it's like, right, someone who's metabolically healthy, someone who has nutrient status that's optimized is going to yield very different results. They're going to need very different drugs than someone who isn't. Okay, so this is the power of the work. The first of all, we want to debrief the cycle or the cycles. We want to understand the actual data. What was the protocol used, the doses, the trigger type, egg numbers at each stage, the embryo quality, if you had any PGT testing. We want to look at the lining thickness, the progesterone, thyroid, vitamin D, ferritin, DNA fragmentation. We have a 3-step process in our clinic. It's to clarify, correct, and then conceive. That clarify stage is really important. We need to debrief everything that you have done. And then the second step that I would be doing is rebuilding the foundation. So not only do we want to debrief everything that you've done, but we want to run some deeper testing to understand why your thyroid is out of whack, why your immune system is out of whack. Most people need, and I say most, everyone needs a really good detox before they even think about trying to get pregnant, because of the world that we live in. And if you have no idea what you're detoxing, or the level of toxins that are built up, or the sluggishness in your liver and your gut, or your nutrients that have been really depleted, when you're going straight into IVF, you're just adding to that toxic load. And usually, just vitamin D or just CoQ10 or just a prenatal is not enough in my world. I don't see it moving the needle enough. And if I gave somebody a prenatal, vitamin D is great, and most people need a high dose, but whether that's 5,000 or 10,000 or 3,000 I use, depends on each person. But if I give someone a prenatal, that's not going to correct some of their bigger nutrient deficiency, because there's just not enough in that prenatal. And I've talked about this a couple of times, but we don't actually recommend prenatals because we run so much testing on our patients. We know exactly what they need. We curate their own B vitamin complexes in their own prenatals because we just see exactly what they need, and we kind of cancel out the noise from everything else. Once you clarify and we know what's what, then we need to rebuild the foundation. So for some couples, that's 3 months. For some, it's 6. For some, it's 12. It's highly going to depend on your timeline, your age, your current symptoms, what you have been struggling with. I always set realistic expectations, and I always have these conversations with my patients. Hey, the treatment that I have provided in this amount of time should have worked. If it has not worked now, we need to make some more tweaks to things, or we need to consider other options. And this is where we retest and we look at, is natural pregnancy possible, or do we need to consider IVF or maybe IUI now that we have corrected certain deficiencies. But rebuilding the foundation is really important. Doing a good detox, optimizing your gut function, making sure that your thyroid is good, blood sugar is good, vitamin D, inflammation, iron, all of those things. There's no infections in the vaginal microbiome. Like, I can't tell you how many people are walking around with ureaplasma infections, which are associated with negative sperm parameters and negative pregnancy outcomes. Lots of complications during pregnancy and postpartum if the pregnancy sticks around. That we want to rebuild that foundation. We want to make sure we're walking in as good as we can with a timeline that we have. We're making decisions. And step 3, so step 1 is clarify. Let's debrief your cycle. Let's take a look at other labs and understand why you can't get pregnant. Step 2 is the correct phase, which is like, let's rebuild the foundation. Let's get rid of the infections. Let's make sure we do everything that we can to optimize. And then step 3 is to really decide on the next vehicle from a place of clarity, not panic. Are we ready to conceive? How do we know if we're ready to conceive? Well, we want to retest after we've done some of the foundations, and we don't retest everything, but we retest, like, let's do day 2 and 3, day 19 and 23 again, so 7 days post-ovulation. Typically, there is an antral follicle count done. If we had a vaginal infection, let's say, we need to make sure that that's clear. If there was issues within the uterine microbiome, we want to make sure that that's clear. We want to look at, the thyroid, the cholesterol, the blood sugar. All of those things will tell us where the body is at, and then we can make a decision what the next step is. And for some couples, natural conception is very possible. And for others, we need to have some help. And we have couples who come to us who only want to try naturally. So then we just continue to tweak and make changes until we get the body to that level. Or we honestly just continue to have conversations that, well, there's been too much damage and there's a lot of genetic variability here and mitochondrial damage or nutrient deficiencies that we're just going to run out of time if we keep trying naturally. So again, that's just us as practitioners looking at every case as unique individuals as you guys are, making sure that we're never misleading you, because we don't take that lightly. It's a really big responsibility, and we don't take that trust that you put in us lightly. And I wish that some of the fertility clinics, I know that there's some that are fantastic, but there's a lot of fertility clinics that they don't remember your name, they don't remember your story, they have no idea what you've gone through. They're just kind of putting you on the conveyor belt. You need to run away from those clinics, even if insurance covers it. You are just worth so much more than that. Oh, but this is the only way that it doesn't work. It doesn't matter if insurance covers it. It won't work because you're on the conveyor belt. It's not personalized to you. You're still going to spend that energy, and that emotional energy and physical body is going to go through this big event. Just because you don't, have any financial investment in that doesn't mean that there's no cost to it. So I do think that last step for us to assess, are you ready to conceive, and how are we going to conceive? We try to do that within that 6 to 12 months of working together. And again, some couples have a little bit more time, some couples have less time, and it very much depends on what we find. If we're dealing with heavy metals, it's unlikely you're going to be ready to conceive in 6 months. It's usually 12 months, but we want to make sure that we provide you with the results that you guys want, which is usually a healthy pregnancy and a healthy baby. Now, the last question that we get is, why would natural work if IVF didn't? We hear this all the time. And, if the most advanced tech didn't work, why would nutrition labs and lifestyle do? And here's my answer to you guys. Because nobody actually asked you the question of why you can't get pregnant in the first place. So all the diagnostics that IVF clinics run is to answer one question: will IVF work? Not, why are you not getting pregnant in the first place? That means it bypasses a lot of basic things, whether it's your cholesterol, your blood sugar, your thyroid panel, your vitamin D levels, your B12 levels. Like, the reference ranges are so poor on most labs that they're just looking, are you within the norm versus optimal? So when I see a vitamin D at 31, that's normal. Optimal is 60 to 80, and I want you closer to 80. If I'm a conventional practitioner, I'm going, yeah, well, it's a little low, but it's fine. as a natural fertility expert, I'm going, that's crazy low. Those are for both partners. That's crazy low. So I think it's important to remember that conventional doctors don't specialize in nutrition or supplementation or even environmental toxins. They just don't study it. Most of them don't believe in it. They also don't have the tools. And I'm not saying that from a place of blame. I just think it's like two different branches. When you go to medical school, you're being taught how to prescribe pharmaceuticals and procedures. Like that's literally what they teach you. They teach you, you have this issue. This is how you treat cardiovascular disease. It's not diet and lifestyle changes. This is the medications that we're going to lower blood pressure and we're going to thin your blood. Like it's just such different approach. So you have to remember that. And I think the way that we really move forward with this fertility crisis is a collaborative approach between the two worlds, because some couples genuinely will need help from ART and others are just pushed into it blindly and they can conceive naturally. My sister was one of those examples. She was 37. They told her after 6 months, just do IVF. And my sister would never do IVF. Like her and her partner just decided that if we're not meant to have kids naturally, we're not going to do IVF. And that's not, disrespect to anyone, but we all have our own belief systems. My sister and her husband just said, that's not something that we're comfortable with moving forward. And if they didn't come to me and tell me that they were struggling to conceive, they wouldn't have the 2 boys they have now. And I look at their family and it brings me so much joy. So sometimes I think we put these limitations on ourselves because we don't know. And for my sister, it was like she made the decision to come and ask me for help. Every time you're going into IVF, you're making a big decision. You're putting your body through a really big procedure. So I do think that this collaborative approach is where we need to go. And everybody is going to need different help and support. And everybody's going to be in a different phase of their fertility journey. Some will conceive naturally. Some will need IUI. Some will need IVF. Some will need donor eggs or donor sperm, because the accumulation of damage in the body is too much. And I think the personalization is where it really matters. So if you don't feel like things are personalized, and you feel like you're going into a procedure blindly, it's because that is what's happening. And I want you to feel empowered as a woman because you are the first place that the baby will grow. So I want you to feel confident going into that cycle. And in order for you to feel confident, you need your man supporting you. He needs to know what's happening. He can't just be a sperm donor. And you need to have data and knowledge and an explanation. This is why things are not working. So we're going to try this. And this is how your body is responding. Oh, it's responding too much. Let's lower the dose of this medication because we don't want to overstimulate you. Estrogen is rising beautifully. Okay, it's time to trigger. Oh, now it's time. Your progesterone is at levels. That will help you feel in control versus you go, close your eyes and hope that you're just pregnant when they're done. That's what I'm seeing happen more and more. And I think it's really, really taking away from the true experience of, it doesn't matter if you're getting pregnant naturally or through IVF, but you need as a woman to have that control. And that's what I would want for myself if I, needed to go through IVF, and that's what I want for all of my patients, and that's what I want for you guys. So if this is hitting home and, you're tired of being pushed into IVF, you want to see if working with us in the Maximize Fertility program is a fit, please fill out an application down below. We'd love to see if we can help. If we can, we'll show you what that looks like, and if we can't, we'll make sure to point you in the right direction. But I hope you guys found this episode helpful. I hope it helps you save some time, energy, and money, and the way that you make a decision process about going into IVF or not. You take the time to prepare, make sure you have the right team, and we set you up for success. So thank you again for being here, and we'll see you soon.